So spot the symptoms. Is a teacher feeling ill? Contact your administrator or designated person. Coverage should be sent to manage the classroom as soon as possible. If the teacher is experiencing signs or symptoms of COVID, they need to be seen by the nurse. And again, these are the symptoms. They're just reiterating where the symptoms would be seen and what they are. So that's if you are already at school and you start feeling ill. This is what you would need to be seen by the nurse. If you are feeling ill before school, do not come in. Go ahead and take care of the problem. Fill out your health survey on there that you feel those symptoms, but do not come into the building if you are feeling these symptoms before you enter. Tool number 1, monitor yourself. Any staff or student member who is ill must stay home from school. Any staff or student member who becomes ill at school must be sent home immediately. Any student or staff member who has one or more of the following new symptoms must go home. And those were the same symptoms as we had talked about in the previous 2 or 3 slides. The student or staff member who should be tested for COVID-19 and if necessary, be evaluated by their healthcare provider. The student or staff member may not return to school until they have met one of the following criteria. Either 1, they test positive, they must stay home for 10 days since their first symptoms or their positive test, whichever is earlier. Once it has been 10 days, they may return to school once they have not had a fever for 24 hours without the use of fever, as long as their other symptoms are improving. Number 2, if they test negative, they may return to school when they've not had a fever in 24 hours without the use of a fever-reducing medicine and their other symptoms are improving. 3, if they do not get a test, they must stay home for 10 days. So number 2 is if you do get a test. Number 3 is if you don't get a test. They may return to school when it has been 10 days and they have not had a fever in 24 hours without the use of fever-reducing medicine and their other symptoms are improving. Or if their healthcare providers determine there is an alternative diagnosis to COVID-19 causing their symptoms, such as asthma, allergies, seasonal related illness, they may be allowed back to school before the 10 days and without a negative test as long as the following criteria are met. The symptoms have resolved and have not had a fever in 24 hours without the use of and they have a note from their healthcare providers saying that it is safe for them to come back to school. So if you see your healthcare provider and they say that, no, this is not COVID related, this is something that's, allergies or asthma or something else, then you need to have your symptoms resolved and not had a fever using fever-reducing medicine in 24 hours. And your healthcare provider needs to provide documentation that this is not COVID, that they believe it's something else. Questions on that? I will make this PowerPoint available for everybody. They should have changed the screen because this is not current with the new CDC guidelines. I believe they made this way back. Made this way back in August based on information they had in March. The new CDC guidelines said surface to person transfer is very unlikely. It is possible still, but there is not something that we should see as a definite transmittal point. Some virus may spread from very small particles. At the current time, it does not change the guidance to follow. Tools to stop the spread: staying 6 feet over, covering your cough and sneeze. When in public, wear a cloth face covering. Do not touch your eyes, nose, and mouth, which is something I still have not mastered myself. Clean and disinfect frequently touched objects and surfaces. Stay home when you are sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. And then there's stop the spread of germs in English. It's just a poster. Okay, next one. So here, many symptoms of COVID-19 are also present in common illnesses such as strep throat, common cold, the flu, asthma, and seasonal allergies. And then the CDC symptoms of COVID-19 pretty much the same as what we just saw. It's where they got their information for their chart. So all of these symptoms here that are written are also possible in other areas. Monitoring and know the symptoms of COVID-19. Again, this is that poster. These are symptoms we've already gone through. I think they've gone through these. Fever and chills, cough, shortness of breath, difficulty breathing, fatigue, muscle and body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, abdominal pain, discomfort, nausea and vomiting. I can tell you when I had my bronchitis earlier this year in August, it was horrid. I had cough, I had shortness of breath, I had fatigue, I had muscle aches and chills, I had sore throat, congestion and runny nose, and a little bit of nausea. And so I did go get a COVID test, and I was negative, but there were a lot of these symptoms. And the part with the shortness of breath, difficulty breathing was terrifying, which made me think that I did have it because it was so much harder to breathe. But it was just my usual, my lung problems that I usually get with seasonally. So just more problem this time. Oh, come on. Why are you doing that? Upon arrival at school, or before you leave the school, using your phone, staff must fill out the staff health screening form on the computer. If a student is feeling ill or showing signs of illness, contact the school nurse and maintain privacy. If you are feeling ill, contact your supervisor, district nurse. When school is in session, school office will direct ill person to isolation room. At isolation room, designated staff are to put on a face mask and face shield, which is what they will already have. If Nurse Mabry will have that on once everyone has to have their face mask on to enter the building anyway. I'm not sure why they put that in there. Anyway, if they are touching the person or must be within 6 feet, they are to put on gloves and a gown. So Nurse Mabry has a gown and PPE that she needs to wear to keep herself safe if she is going to be in contact with someone who is potentially ill. Remain aware of implicit bias. Screening should not include evaluation of racial, cultural background, clothing, hair, cleanliness, personality, or ability. If you're screening, it should be based on the fact that they're one of the children in your class and nothing else. Monitoring others. If you have been exposed to someone with COVID-19 and you do not have symptoms, exposed means that you have been within 6 feet of the person for 15 minutes or more. Contact your supervisor and stay home for 14 days after exposure, even if you test negative for COVID-19. If you are a close contact, you must stay home for 14 days after exposure, regardless of test results. Monitor yourself closely for symptoms. If someone in your home or community living space has symptoms of COVID-19 but has not been tested, then contact your supervisor and stay home. The amount of time may depend on the situation. Monitor yourself closely for symptoms and encourage the symptomatic person to be tested. Yes, Ms. Jones.
So is the 15 minutes based on the newest guidelines, which is 15 minutes total combined over 24-hour period?
Yes.
Okay.
Yes. So it may be 5 minutes you're away from them, and then 5 minutes. That person that has the COVID, 15 minutes total time exposure to that person makes you a close contact. Ms. Thomas?
So my question, I see some others have the same question. If we have to stay home for 14 days, do we have to get a sub, or are we going to be Zooming lessons during that time?
They're still working that out, because if it's a matter of the classes staying home, then you're going to Zoom lessons. If it's a matter of just you and the kids are here, they're trying to figure that out. That's one of the details they're still working on. I know. They're still trying to